Hi everyone, it's 3 o'clock. This is Janet Hill. Thank you for joining us. I am the Chief Operating Officer at the Rock Island County Health Department. Today we are announcing 6 new cases of COVID-19 in Scott County, bringing the total to 16. In Rock Island County, there are 4 new cases, bringing the total to 11. Today we are also trying to give you a look at the direct recovery response going on during this crisis. We will be joined by Kelly Thompson, who is Vice President of Grantmaking and Community Initiatives for the Quad Cities Community Foundation. First, though, we will hear from Nita Ludwig, who is Administrator of the Rock Island County Health Department, and Ed Rivers, Director of the Scott County Health Department. All participants will take your questions at the end. As we have been doing, please type them in the chat box. The question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. Nita, please start us off. Thank you.
Good afternoon. We would once again like to thank the community for responding to the many requirements we have asked of them in the past few weeks. By and large, we have seen our community stay home, limit their interactions out in public, work from home when possible, and stay home when they begin showing signs of illness. However, we must ask that you continue to hold tight and keep the social distancing up in the upcoming days and weeks. We cannot let up now. Our ability to successfully social distance is what is going to make the difference in our community. We have the ability to protect both our community and ourselves. For our community, we can best protect those around us by staying home as much as possible, limiting our trips out for only essential needs, and self-isolating at home if we begin to show signs of illness. We can best protect ourselves by minimizing the spread of germs around us. Make sure to clean frequently touch surfaces in your home and workspace, such as countertops and door handles. In addition to the other steps you're taking, use hand washing as your best line of defense against COVID-19. We know it sounds simple, but washing your hands frequently with soap and water or using hand sanitizer is such a huge factor in preventing this virus from spreading to yourself or to others. As the weather gets warmer, we understand that you'll be drawn outside. Going for a walk, hike, bike ride, or run is perfectly fine, as long as you keep 6 feet of distance between you and others that you might meet along the way. Cities throughout our region are making decisions as to what outdoor facilities are open and closed. Please consult your city's website for the most up-to-date information. Throughout this crisis, we have talked about the response from state leaders in Illinois and Iowa, and they might be different. Information came from Springfield that golf courses are no longer allowed to stay open. However, in Iowa, golf courses are open, but you should call ahead to find out what specific rules at that course. Now is not the time to get complacent. The best ways to prevent COVID-19 include social distancing by staying at home as much as possible, keeping at least 6 feet between you and anyone else, washing your hands frequently with soap and water for at least 20 seconds each, and using hand sanitizer when washing your hands is not possible. Covering your coughs and sneezes with a tissue or into your elbow, and staying home when you are ill. If you think you may need to seek health care, call first. Your provider can address whether you need to be seen in the office or whether you can recover at home. And now I will turn it over to Ed Rivers from Scott County Health Department.
Good afternoon. Let's talk about masks for a moment. This weekend, the Iowa Department of Public Health provided new guidance on homemade mask design guidance. This guidance encourages individuals interested in constructing masks to make them as requested by the healthcare facility where you plan to donate. If the healthcare facility does not have a specific plan, then they should be constructed using the specifications published by the governor's office. You can find the guidance from Iowa on the Together QC website. The Salvation Army in Quad Cities is collecting masks made by the guidelines, and they're also taking any other personal protective equipment, including medical gloves, masks, and gowns. Donations continue to be needed in the community. Individuals or businesses interested in donating PPE should contact the Salvation Army at 324-4808. Now a bit on test results. As testing takes place in our community, we've been hearing feedback on testing timelines. Private providers take swabs from individuals they believe are showing signs of COVID-19 illness. In Iowa, the samples are then sent either to the state hygienic laboratory or private labs. Results sent to the state hygienic laboratory if the patient meets the testing criteria. These are taking 2 to 3 days to return. In Illinois, results sent to one of the 3 state labs, Chicago, Springfield, and Carbondale, are being turned around in 1 to 2 days. In both states, we're being told that results sent to private labs are taking 10 to 14 days. Results are being sent to the provider that requested the test. Just like for other labs, individuals can expect to hear their results from their provider's office. As a reminder, the individuals that may contract COVID-19 illness, up to 80% will experience only mild or moderate symptoms and will likely not need to see a medical provider and can recover at home. This will help to minimize the spread of illness that is more likely when an individual goes in for COVID-19 testing and preserves personal protective equipment, PPE, that is needed for any individual, no matter how ill, when they present for a COVID-19 test.
We will now hear from Kelly Thompson with the Quad Cities Community Foundation. Kelly?
Hello, thank you everyone. I really appreciate the chance to share with you today. Many of you have received a press release directly from the Quad Cities Community Foundation about what we're doing with the Quad Cities Disaster Recovery Fund. The Quad Cities Disaster Recovery Fund is our community's way to respond to disasters when they happen. It was established in 2016 to position us in the best possible way to respond swiftly to emergencies and disaster if and when they happen. It was activated for the first time last year in the flood and has been activated again for this pandemic response. People and businesses are making gifts now and have been over the last couple of weeks to help those most vulnerable and most affected by this pandemic. In partnership with United Way of the Quad Cities and the Regional Development Authority, we've already raised more than $580,000 in gifts and commitments for our community response, but much more is needed. As of the end of the day last Friday, application requests amounted to nearly $2.5 million in need. Right now, we can meet about 23% of those needs. Grant requests are being evaluated by a team from the Community Foundation, United Way of the Quad Cities, and Regional Development Authority, who are all experienced grant makers and informed by these calls, as well as the Disaster Ready Quad Cities Coalition of organizations responding to disasters in Scott and Rock Island counties. Our press release today announced the first round of grants made from that fund for this response, $350,402 to 19 nonprofits, which amount represents nearly all of the cash on hand thus far, dollars that actually have come in the door versus the commitments that have been made to us but have not yet been paid. Grants are available to nonprofits, schools, or organizations providing basic needs services, things like food, housing, access to healthcare, support needed for those experiencing job loss, for example. We are really shoring up that safety net and also addressing health needs. But I emphasize we can only grant what is given, so we are really asking every Quad citizen, every organization that loves the Quad Cities to share some of that love, make a gift to the fund. 100% of every gift will go to this disaster response. The Quad Cities Community Foundation is covering the cost of administering the fund. You will have in your packet the link to give. It's at qccommunityfoundation.org/QC Disaster Recovery, and more information is available at that website. Thank you.
Thank you, Kelly. This is Janet again. Another opportunity to help the community is through the Riverbend Food Bank. They are continuing to distribute food to people who need it, and they are seeing increased expenses because of prepackaging food boxes and more deliveries and having to purchase food. So they are asking that people give money instead of food at this point, and the easiest way to do that is to go online at riverbendfoodbank.org and then click on the donate button. Brooke, what kind of questions do we have so far?
Thank you, Janet. We do have the first question here. Do you think this area will hit its peak in 2 to 3 weeks or sooner? That may have related to some discussion with the governor of Iowa yesterday. Ed, do you have anything to add to what she described?
I haven't read anything different from the opinion you heard from the governor.
Next question. A survey of U.S. mayors showed many cities don't think they have an adequate amount of PPE. Do you know the situation at Genesis or Trinity? Are they running short, and can N95 masks be used over? Is this safe? Nita, have you been in any of those discussions that have been taking place with the EMAs on both sides of the river and the hospital systems?
Yeah, I will say that I cannot speak to their current amounts, but I do know the emergency management agencies have been working very closely with both hospital systems, and they have been using their chain through the state of Illinois and Iowa to procure as much PPE as they can from the caches through the Strategic National Stockpile.
Thank you. What would it take for the coronavirus to be considered widespread in the Quad Cities? Ed, do we have a handle on that?
Well, the Quad Cities is not a large area, so using a term like widespread may be a bit of a reach, but if we had a number of cases throughout the areas of both counties, I suppose you could consider that widespread.
Is there any tracking of patients regarding where they were, who they were in contact with before they displayed symptoms? Are those being privately contacted by, are those people being privately contacted by the health departments and hospitals? Nita, I know you spoke a little about this last week. Would you mind reiterating some of those points as well?
Sure. So we do have nurses in our infectious disease department, and that is what they do when they get a positive case. They will go back and do what's called contact tracing. So they will research where that person had been, who they may have had contact with, what kind of places they visited, what family members might be, had some exposure to, all of those sorts of things. So yes, that is done here at the local health department.
Next question, Anita, this is probably to you again. Governor Pritzker just said Illinois is only getting a fraction of the orders they've placed for PPE, which is personal protective equipment, and they are being distributed by highest need. Is the Quad Cities getting much of that, given the need is so much higher in Chicagoland?
Yes, I really can't speak to the amounts that they're getting, but yes, I'm sure that they are kind of divvying up depending on how much they get. I do know that our EMA, our Emergency Management Agency, did get a small pallet of goods over the weekend, and I think they are supposed to get more sometime this week as well.
Is the curve tapering off yet or continuing to go up at a similar rate as the past week or so? What do you base projections on to decide when the hospitals in the Quad Cities may be most busy with COVID-19 cases? Ed?
Well, if you look at the Johns Hopkins coronavirus map site, I looked at it this morning, and the curve seems to be still headed upward. I don't know exactly what is meant by the second half of that question, but the hospitals themselves would be doing surge plans. I know that the Emergency Management Agency has been meeting with the hospitals regarding surge planning. So that activity is in operation currently.
Thank you. Next question. Governor Pritzker says he wants 10,000 tests done across the state daily. How many tests can be done on the Illinois side of the QC in one day? And are you doing anything to increase the testing numbers? Nita, I don't know if you have some response that you can provide.
I'm sorry, can I repeat the question, please?
Sure. It looks like there's two parts to that. Governor Pritzker says he wants 10,000 tests done across the state daily. How many tests are done on the Illinois side of the Quad Cities in one day? And are you doing anything to increase the testing numbers?
Okay, as far as how many tests can be done in the Illinois Quad Cities in a day, that I cannot put a number to right now. We do have urgent cares, we have hospital emergency rooms, we have community health care with multiple sites, and whatever their capacity is, if they had enough test kits, I am really not sure of at this point in time. But I do know we do not have the test kits yet to be able to test widespread in the community. And as far as what we are doing about that, that's really at a level higher than a local health department. And that is really what I think Governor Pritzker has been working on with, you know, the vendors and the state Illinois Department of Public Health as well.
Thank you. And Nita, you did reference earlier in your talking points that we've talked about the response from state leaders in Illinois and Iowa being different, same as with the local response. The last question we have so far is, our bi-state community is experiencing different state rules and guidelines, such as related to testing availability and even disclosure of test results. How are these conflicting standards and practices helping or hurting our community's unified response?
So for Illinois, I have not seen that it is detrimental. I think in general, the citizens just need to know that there are differences. Like we mentioned earlier, the golf courses on the Illinois side are closed under the governor's proclamation, but golf courses in Iowa are open. So they just need to check if they're planning to do an activity that, if it's open in Illinois, then it may be different in Iowa.
Ed, would you like to add on to that?
Well, the situation in Illinois and Iowa is different. Illinois has many more cases than Iowa, and restrictions are being implemented in a measured fashion in Iowa. We are advised of every positive test, so I don't see any shortfall there.
We'll give it another minute. If you have any additional questions, please type it into the chat now. Okay, not seeing any additional questions in the chat. We'll go ahead and conclude today's press briefing. We again appreciate your assistance in getting this information out to the public and helping to share these important public health messages. We do intend to have some sort of at least press availability for tomorrow, so please be watching for that information. We do have one last question that we'll take, and then we will be concluding the call. Do you believe Rock Island County and Scott County are doing pretty well right now? Ed?
Well, we're certainly not as affected by this disease as other counties and other states. I'm hopeful that our response earlier in March and getting the word out to people about social distancing and how to protect yourself from the disease will help to keep our numbers low.
Nita, do you have any final thoughts to add to that before we end today?
I agree with what Ed just said. I would just reiterate the point of not getting complacent. Keep washing your hands, keep your social distance going, make sure you have 6 feet between you and others, and stay home if you're ill.
Thank you so much to our speakers and as well to those of you on the call, and be looking for additional information from us to come. Thank you very much.